This is a general walkthrough for general surgery rollout to provide tips and tricks. The key thing is working off your daily schedule. Work off these patients. Aim to get your notes and dollar signs. Notes and dollar signs. Utilize your status windows here, either from the floating clinical toolbar or from the highlighted area here as well. Clinical toolbar allows you to get those vital signs in the context of the visit there. After entering data, you have the opportunity to commit it. You get a chance to review what you just did and who you did it on. Most of the time, you're going to click the commit button and save and continue. Those vital signs are now linked to that appointment and will pull into the note that you start. Go to the note authoring. Remember, if you forget what these items mean, just hover on them. And you'll get the feedback about what these are. So when you go to the note selector, you've got the V11 note type all the way to the left for the style, general surgery specialty, who's going to be the owner of the note, and then the main visit types. Just spend some time looking into these different categories of notes, from the different kinds of communication notes to initial visits, nursing visits, a general kind of office visit, predominantly a follow-up. If the surgeon is doing the pre-op H&P, or if they want to particularly mark the visit type as a consult. Then you have a variety of post-op visit types and a more general post-op note, and then a general note for if the only thing being done at the visit is a procedure. Otherwise, any procedures can be put into the other visit notes, even if it is just a general surgery initial note. It's just specifically bringing the patient in for a certain procedure. So I'm going to start this breast initial note. This would be the nurse workflow. Starting that note, they can click the view button just to make sure they see what's pulling in so far, see if their vitals have pulled in, see what medical history has pulled in. Put in their chief complaint. If there was already any history related to the problem, you'd have these data forms from your previous paper forms that you could fill in, or any other particular history that needed to be added. You can, the area above this double dash line is kind of felt to be, yes, kind of medical assistant nurses to try to get the history part of a new patient documented on the chart. Any of these, when a section is in bold, that means that there's already data there that's going to show. If it's not in bold, it means there's nothing in there. So yes, here's a family history, and you get the history that there is a cancer history. This is a very generic cancer history, but you could go into the edit pencil and mark who the family member is and click the details and add. more detail. That's one approach. Obviously, the other approach is to actually go to the full family history area and find from here. There's a quick area to add some social history here as far as tobacco, employment status, alcohol, allergies can also be added here as well. But getting the chief complaint in there, getting any other data that you're used to putting on the piece of paper for the doctor, and then clicking save and close. If you know what the visit is going to be about, you can help the doctor along by getting that diagnosis assessed. So here, yes, you know that this is a visit about this breast cancer, if it was already diagnosed, then that can be added on in the assessment to help with the doctor when he does his orders. If it's really unclear what the assessed diagnosis is going to be, then you leave it blank. And the doctor can use these assessment forms to quickly add diagnoses, or also be able to choose from what's already on the chart as diagnoses. Because getting that assessment is a big change compared to just dictating a note, but it's what will streamline how the note looks, that what diagnosis was actually assessed at the visit, and it's what drives the ICD-10 code that will go to the encounter form to be billed out after review by the billers. So you start the note type that's appropriate. Make sure that the owner of the note is correct. Type in your chief complaint. Add any history. Make sure the vitals have been entered. Fill out any other details down here that would be appropriate or helpful to the physician, and then save and close. Now we have a note, a room number, and it's provider ready. So this is where the doctor has their opportunity. So the doctor can have two ways of interacting with the chart that the day of the visit. If the patient has not arrived yet, then the doctor can double click on the name of the patient and move from the daily schedule over to the clinical desktop. Move from daily over the clinical desktop, right? So I can go back and forth. And whoever's highlighted and up in the banner bar, I'm going to go to their clinical desktop, and here's their chart. Or I double click and it does the same thing. So just learning that there's no magic there. It's just moving around the chart, going from the daily schedule, which has multiple patient names, to that specific patient's chart. So now I'm not on a schedule. I'm not in the context of any other patient. I'm on that particular patient's chart. And I can, from here, I can look. So from here, such as this note from May the 24th, I can double click the note and open it up to read that, to read what was the results of that. You can close the note either down at the bottom or up at the top right. Whenever you see a screen that says viewer in the upper left, it's okay to click the X. You're not going to X yourself out of Allscripts. So this would, if you wanted to review any notes, this would also contain results. If there's a lot of information in the chart, you can jump to the results tab. So there are any scanned CAT scans, ultrasounds, and lab results would be in this area. If you wanted to go in and follow up on the status of a certain order, a certain procedure that was going to be scheduled, then yes, this is where you'd find that. So you look for these little asterisks. So this asterisk for this procedure that got ordered You double click on the order. You click the annotations hyperlink along the top. And then you would see down in the annotations area what the scheduler has written about the status of that procedure if you wanted to check up on that. So that's the step if you want to review the chart before the patient has arrived, before the nurse has started a note, before they've put any new vitals or new chief complaint in there. Once they've started a note, once they've got them in a room, provider ready with a note, then you click into the note. You don't click up here. You don't double click on the name. You actually get in the habit of clicking that small note. Just a single click is all that's needed. And then a single click on the view button in the bottom left. And so this is what you want to see. This is like the piece of paper that was sitting in the chart. You're going to see what the chief complaint is. But then, yes, for new patients, it's going to pull in all the history for your quick review, some vitals. Who will be the one that will get a carbon copy will automatically show to you, so you can decide that's going to work, or you can learn how to add others on at a later time, either right then or at the time that you sign the note. And this will give you an idea of what's already in there. Be mindful that there's currently no diagnosis assessed. So if the provider does not see an assessed diagnosis, that's one of the key parts you're going to have to remember to do before you put in any orders and do any billing. So if you just wanted to review the chart before going in the room, yes, that's this view will show you what's happening today. It will also pull in any lab results from the last 3 weeks, or if the nurse had typed in any results, or may have put a notation in the chief complaint. See CAT scan on chart. If you did need to look at that CAT scan, you use this area over on the right side to look at the chart and find the CAT scan. You can open up the notes from over here, and it will open in a window right there while your note's still there. If you're having trouble reading or seeing certain parts, you can move this back and forth to help fix the split, or you can get a full screen view right here. Clicking that tiling button, you get a full screen view where you can have your whole note, or you can see the entire chart all in one screen. This will start as the default, but that can be changed if it's not working for you, especially when we get to the orders. You notice the orders down here. Sometimes the screen will be split like this and you won't see all the orders. And so you might find that the full screen view will work better to be able to see all the orders. Once you're done with your review before going into the room, you save and close the note. You go into the room, see the patient, and come up with your plan. Then, if the nurse is in there with you, they can have pulled up the note and you can work on entering those orders together, or you can make your choice whether you enter orders, exit the room, go into the orders. You will have the paper and counter form that mimics the orders. So whether it's the nurse helping you get those orders in, or whether it's you getting those orders in, you want to get onto some device where you're quickly getting into that note, a single click on that note. And when you're ready to get orders in, you're not at a point of doing any data entry unless you want to. Yes, if it's a brief visit and you want to go ahead and add a text macro, or use your M modal, or another text macro for a quick exam that you can create according to your needs, but that's not necessary. The main thing to get the patient out of the office is to get the orders in. If it's just a follow-up PRN, you probably don't even need to do this. Write follow-up PRN on that paper encounter form and walk them to the front like you usually do. But any other order, any other thing that you're going to schedule or any other follow-up besides PRN, you're going to want to come to the assessment area and pick their diagnosis. If the diagnosis is already here, great. You want to assess it by clicking on the piece of paper. If it's not in here, then you can try and find it down in this quick diagnosis selector below. Or you would click this new button to go search for it in the master search area. So I'm just going to add this particular diagnosis here. When I add it from the form, it actually goes ahead and adds it to the list and it assesses it. See, we now have an assessed diagnosis. Now, before you start doing any orders, I do recommend going ahead and committing that diagnosis to help it link to the orders and to the visit code. But so assess it, commit, save, and continue. And now you can start doing your orders. So you see now we jump from assessment to the orders, recommended orders. These is a kind of a quick area to get some orders. And it already has the diagnosis here that it's going to link to those orders. As mentioned in training, you only need to click on pre-op testing if it's something that the nurse would not usually order through your pre-op order sets. It's something out of the ordinary. If the particular surgery that's being scheduled, it's ordinary to order something, you don't need to order it here. This would only be a situation where you don't ordinarily order an EKG and you're going to get one. You don't ordinarily order a chest x-ray and you're going to get one. So that's what these are for, to provide for those unusual situations of pre-op tests. For labs now, so you just keep an eye on these headers to help guide you. And the paper encounter form has these same headers, same detail. For imaging, this will take some getting used to, but it's clicking on the box is when you want to order something now. You want it to be done at the next available schedule. If for some reason for many of these that you want to do it in the future, such as 3 months, then you're not going to click the box. You're going to right click and choose edit. And then you're going to look up near the top for the to be done date. And you're going to click that calendar next to the to be done date and advance it to where you want it. So if it's something to be done 6 months from now, you can advance the calendar to that date. Click OK. OK out of the order. And now that's going to go to the staff as an order on hold for scheduling, requested for December 3rd, to get put into the callback system. That same thing applies to any order, any lab. You can do the same thing for a CEA if it's a 3-month CEA. Right-click, edit, click the calendar. I want it done 3 months from now, okay? Well, my quick way of getting to 3 months is you can use this jump button down here. This sets, when you click one of these buttons, how far it's going to jump. So if I want it to jump 3 months, I can go click that up to a 3, and then I click that, and it jumped me to 3 months. It's on a Sunday, so then I can click it over to the Monday the 4th. So there, I've now jumped 3 months. Procedures, you'd have a quick way to add a procedure risk benefits discussed statement. into your note right at the time that you order the procedure. This will show up in the note when you click that button. Clicking on a procedure will open up the box to choose a side. And then the follow-up order is really just as important as many of the other orders. And then if there's orders that are not listed here that you need, that's where you have to learn how to use your clinical toolbar up here. So you go back up, it's not here. All right, well, I need to order a lab. Or you can click the drop down and there's something in imaging. There's something that I need to get, a plain x-ray that I didn't see, or a certain ultrasound that I did not see. Learning how to navigate this add clinical item, where you have a chart over here on the left quarter of the screen, and then you have all the different orders. And after you've been using the system for about 6 weeks, you'll probably start to learn the problem-based orders. Problem-based orders from when a problem has been assessed and orders linked to it. You'll now have your own specialized order set for that problem. And so you'll learn how to use that. Right now, they'll likely be empty. So if once you've added on any other orders that you didn't see in the note, you click OK. And this is just reproducing what you would otherwise put on that paper encounter form. You don't need to, at this point, document anything else. Just get the orders in, just like you would write orders on the encounter form. And then save and close the note. This will commit those orders. Save and close. You'll see the orders that are going in. Save and continue to commit those orders. And then now you can move on to the next patient. Once you've done this and gotten the flow down on a couple of patients, you'll get the hang of what you need to do to efficiently get the patient out of the office, with the backup being putting it on the paper and having a nurse enter those orders in for you while you move on to the next patient. If that's going to be the case, then that piece of paper, rather than you walking the patient up to the front, you either have to go find the nurse and hand it to them, with the patient staying in the room, or the patient walked out to sit in the little scheduling area, or you leave the patient in the room and hang the encounter form on the door with a flag to say that, help with orders. You need help to get the orders in there that you've written down so you can keep moving. But the goal is that either when the nurse is in the room with you, you work together to put those orders in before taking the patient up to the front, or you get on a computer, either in the room or the one outside the room, to go in and quickly assess the diagnosis, enter the orders, and then get the patient where they need to be, either before you enter the orders in or after. So dealer's choice there as far as how you want to do it. It is a change that will need getting used to, but it can be done quite efficiently and saving you time in the long run with your notes, because your notes will already have the detailed plan of orders in them. That's all on this help video. Hopefully it's been helpful to you. Stay tuned.